So Rhenium-SCT is the use of Rhenium-188 radioisotope paste that is applied to non-melanoma skin cancers, and it is currently approved in Australia by TGA for BCCs, SCCs less than 3 millimeters thick. We were fortunate to take part in the EPIC clinical trial, of which I'm the primary investigator, where over the last 2 years, we've recruited approximately 200 patients and applied this treatment to them. The early follow-up, which is now published at 6 months, showed a 97% response rate of this treatment for non-melanoma skin cancers with a excellent safety and toxicity profile. The majority of the patients where this was very useful is on the head and neck region, within the webbing of fingers, on the lower limbs. And these are places where surgery or conventional radiotherapy may be difficult to have or tolerate. The current benefit of Rhenium-SCT to the patient, or from a patient's perspective in patient-reported outcomes, is that it is a single session treatment. So we're looking at a non-invasive single radiation treatment session to solve a problem. Its most value, I believe, will be in the head and neck region where there's cosmetically or functionally challenging areas to treat, which is the nose, lips, ears, and around the eyes. I would certainly say Rhenium-SCT is a promising new tool in the toolbox for skin cancer doctors, and will have a role to play in Australia in the future as well.